Again, we're grateful for our legislators, and I see a number of them on. I'm going to give them an opportunity to provide some brief remarks as we get underway. I see Assemblymember Bonta, Assemblymember Limon, and Assemblymember Burke. Why don't we start in that order? Assemblymembers Bonta, Limon, and Burke, if you want to have some brief comments. Assemblymember Bonta.
Thank you, Superintendent of Public Instruction, Tony Thurmond, for your ongoing leadership. Appreciate your friendship and your ongoing push to fight for our young people throughout the state, and for bringing us together once again to continue the discussion. I'm Rob Bonta, serving the California State Assembly, representing Oakland, Alameda, and San Leandro, and I appreciate the opportunity to talk about how we can fund de-escalation and restorative justice, counseling, social emotional support. I think in this reality of limited funding and likelihood of limited funding from the state going forward into the near future, we really need to consider and explore partnerships with our philanthropic community. I would also encourage us to consider our California businesses as partners, many of whom have already demonstrated and continue to seek out opportunities to demonstrate corporate responsibility and support in this moment. And we've seen throughout the pandemic the partnerships and collaboration turning into real outcomes for our most vulnerable, including our young people, with respect to hotspots and tablets and Chromebooks being provided, also in the medical space, PPE, even ventilators, successful efforts to bridge the digital divide. And it was wonderful to see philanthropy come together with the state to stand up for our vision of a California for all, and provide that pot of funding for our undocumented Californians who are left out of the federal stimulus package. So much more to do. And I want to just sort of raise the question at the outset: what would attract philanthropy and California businesses to partner with California? Is it seeking universality, for example, making sure every student in California has a Chromebook or a tablet or a laptop and access to the internet? Or is it something that's more deep and focused and targeted? These are different approaches, but I really appreciate the opportunity to be here with you. Thank you for your ongoing leadership, Superintendent.
Thank you, Assemblymember Bonta. Thank you for your leadership in this area and for raising a broad approach to, in addition to these programs, the importance of devices for our students so that they can actually get counseling in a remote era. Thank you for that. I'm also happy to have our colleague, Assemblymember Monique Limon, who is on. Please share any words you'd like to share.
Thank you, Superintendent Thurmond. It's good to be part of this conversation. I know that as a former school board member, I actually was on the school board in the last recession and know how difficult it was. And it was partnerships, both with local government, our cities and counties, to be able to fund some of these projects, but also with philanthropy. I think that there are a number of things that we've learned, not just as legislators, but as school board members, school leaders, the school community as a whole, that could help us in this particular time that is even more challenging than I think it was last time. As the chair of the Select Committee on the Nonprofit Sector, we talk a lot about the partnerships locally, but we also know that there's equity issues among those partnerships through community, school district to school district. We don't all have the same access to the same philanthropic resources. So I hope that this conversation also perhaps guides us in a way of how we can think strategically statewide and how we can make those partnerships more equitable amongst the state. Not all communities have access to some of these incredible opportunities, but I think it's really important. And I hope that we can also engage our nonprofit sector in a more formal way, like Cal Nonprofits. Is there something we can do, an initiative, just in the same way we came together to partner around helping our immigrant community this year? There could be ways that we could do this, and I look forward to being part of those conversations. And thank you, Superintendent, for gathering us and allowing for a conversation, a much needed conversation, to take place.
Thank you, Assemblymember Limon. You chair an important committee in this conversation, and your experience on the local school board is informative and helpful. We appreciate you. Also glad to acknowledge our colleague, Assemblymember Autumn Burke, who also chairs a very important committee that people don't understand. That when you talk about revenue and taxation, you're talking about how programs like these are funded in the state. She's been a champion for how we will reverse poverty for our children in our lifetime. It's an honor to hear from you, Assemblymember Autumn Burke. Assemblymember Burke, you may still be muted.
I'm unmuted now, sorry. We've known for a long time that we need to support the whole student. And this starts with demilitarizing schools and focusing on physical, mental, and the social well-being of every child. I would be remiss, obviously, if I didn't mention that African-American students need achievement support programs now and investment in counselors now more than ever. For those, I want to thank for those who have implemented and encouraged the implementation of restorative practices at schools. I want to thank you for your forward thinking. And it is truly my hope that this is a time to make a plan to move forward in that direction for all of our students and all of our schools in the state of California. I really want to thank the superintendent for continuing to push our education system and those who benefit from it, for pushing it to be the best it can be for our students. I thank you for allowing me to participate in this conversation. It's an important one and it spans a lot of topics. And I appreciate the other members and those panelists that are here today. Thank you, Superintendent.
Thank you, Assemblymember Burke, for your leadership on your committee and for framing it in those ways that we have to focus on the direct impacts to African-American youth, to Latino youth and low-income youth. And thank you for your steady leadership in this area. Our good colleague, Assemblymember Ash Kalra, has joined us. We're excited to hear from him. He's no stranger to the social justice world. His work for many, many years, even before the Assembly, in restorative justice and restorative practice is widely known. He chairs our Labor Committee. We're grateful to have you, sir. Any comments, Assemblymember Kalra?
Yeah, thank you so much, Superintendent. And Tony, you've been such a huge advocate for children your whole career. And to your last point there, though, in terms of my history with this, I was a public defender for 11 years, and I saw what happens when you have young people that are caught up in a system that doesn't value them. And I think that when you see our system that does the things the wrong way. And that's why this conversation is so important. How do we do it right? Not just in terms of restorative justice, but in terms of getting the tools to our students so that they can reach their full potential. Because I can tell you firsthand that the other way doesn't work. And criminalizing our students, policing our students, we see the results of that. We have a movement around this nation pushing back against that. So the timing of having you in your leadership position, Superintendent Thurmond, cannot be better, frankly. This is the time for you to lead and for us to be with you in that journey as well as with all the other partners that are joining us this morning. So I'll just stop there and I look forward to the conversation.
Thank you, Assemblymember Kalra. We are honored to have your participation as we are all working together and to be guided by the experience that you bring to this as someone who has really championed alternative forms of policing and to incarceration throughout your career. We're grateful to have you here. We'll hear from some other legislators throughout the day. Some will be dropping in throughout the day, and we'll invite them to make comments as we get underway. We will get underway, though, and I want to acknowledge someone on our team who's been largely responsible for helping to organize today's hearing, and that's Mary Nicely, who is the Senior Policy Advisor in our office. I don't know what we'd do without Mary. I'm grateful to you, Mary, for all your great work. I'm going to turn it over to Mary, who's going to help us get underway with our panels.
I think you can all hear me. I need my video turned on. But thank you and good morning to everyone. So happy you could join us here today for this really important conversation. There we go. For this very important conversation. And to lead off this discussion, we thought it was really important for us to talk about and hear from people who have been on the ground working on restorative justice programs, de-escalation, counseling. And our first speaker will be Jessica Black, who is from the Black Organizing Project. She's an organizing director from Oakland, who's actually been working for 10 years on this project to lead the latest, and actually probably the first in the state to have their board defund their police department. We'll have Jessica Black first, then we will have Manuel Carrillo, who is the lead trainer for Forward Change and co-founder of Dignity in Schools Campaign California. Following will be Laura Telmus from Beyond Differences, who has been leading efforts throughout the state in social emotional learning through her her nonprofit. And she'll be joined by Tom Peters from the Marin Community Foundation, who has been working for years to fund programs such as this. So we're really excited to have them join us on the first panel. And so Jessica Black, please, welcome, and I'll turn this over to you.
Thank you. Good morning, everyone. Thank you for having us. As Mary nicely said, I am Jessica Black with the Black Organizing Project. We are an all-Black member-led community organization that fights for social, political, and economic justice for Black people. We have been working on a campaign called Better in Our School Systems campaign since 2011. We have been fighting to decriminalize education and also to abolish the police from schools. This has been a long fight. What we've always known is while, yes, we are in a health pandemic, also the policing of Black and Brown students is a pandemic. As Tony had made reference to earlier, that police do not actually equal safety, and that they actually have more negative impact on students than anything positive. So in our 10-year fight, we really had to work hard to shift the hearts and minds of the school district. It was a paradigm shift. And so this country is at a place right now where it is time for us to actually listen to the people on the ground. People on the ground are in an uproar and they are crying out because they have been unheard. And so we developed a plan, a comprehensive guide called the People's Plan for Police-Free Schools. In that People's Plan, we developed a comprehensive way to actually eliminate police out of schools, because we know that police schools and saying that they equal safety is a false narrative. And in that, we called for more resources. And so some of those resources that we were calling for were peer-to-peer mediation, so that students can be able to develop critical thinking skills. You have to believe in the power of the people. You have to believe in the power of the students to be able to think critically and resolve conflicts. Also, we call for mental health counselors, and really looking at the trauma. What we learned is that many children who were labeled as having behavioral issues actually were suffering from trauma, and that those levels of trauma, instead of getting the services they need, they were getting criminalized, they're getting arrested, they're getting beat up. And so we need to have mental health counselors in schools. We're calling for a real shift in school culture and climate, which is going to take a paradigm shift, and it's going to take all people and all resources in order to invest in this. And so when we talk about restorative justice, we're not just talking about a practice on an individual one-to-one level. We're talking about a tremendous shift, a transformative shift in school culture and climate, which means that we have to make these necessary investments. We have to pull people from the community. We call for something called village keepers, or you'll also see it labeled as peace ambassadors, who are really people who are from the community, who know the students, who know the parents, who have the solutions to be able to mitigate the dynamics that happen on the school campus. We also were calling for transformative justice practices, and this is really to teach those social emotional skills. And so we are really looking forward to people actually investing in these resources and decriminalizing education. We also know that our school districts are completely disinvested in and underfunded, and so any funds that go to or toward changing school culture and climate at this point should go to those schools where people are actually making a step to create that real change and dismantling and abolishing the police departments and contracts. In addition to that, we are also really pushing in Oakland to have a community-driven process. One thing that has happened throughout this 10-year fight that we think is really important to bring up with all the different people at the table is that the process has to be a community-driven process, because the people who are most impacted by the issue are the people who have the solutions. Hence, this is how we were able to win in Oakland, is that we really, it was the people in the community who really pushed the system to do the right thing. And so I guess today, what we would request of you is that you all also stand with us on the right side of history and make the decision to incentivize those who are eliminating police from schools, and make sure that those funds go invested in those schools in order to really transform school culture and climate.
Great. Thank you so much, Jessica. We really appreciate that. And I want to make sure we have time for you to answer some questions later. So now we have Manuel Carrilla from Forward Change and Dignity in Schools.
Hello, everyone. I'm trying to, oh, here we go. Hey, everyone, how y'all doing? Thank you again. My name is Manuel Criollo. I'm the lead trainer for Forward Change and one of the co-founders of Dignity in Schools Campaign California. And I spent over 18 years at the Los Angeles-based Labor Community Strategy Center and worked over 10 years in its community rights campaign, organizing students, parents, and teachers to end the criminalization, punishment, and policing culture at Los Angeles Unified School District. DHCS California is a grassroots alliance of close to 20 organizations across the state. Many of its core member groups have led important decades-long efforts to end zero tolerance, policing in schools, and demand for true community control and transformational educational justice. I would be remiss if we don't fully grasp that this moment where students, parents, school districts, and communities are revisiting and demanding an end to policing in schools and reinvestment strategies, who are looking for sort of healing and reparative justice alternatives, are not a coincidence or a rash response. It's truly decades long. Within DSC California, we can document over 20 years among our members, organizations organizing around these issues. The truth is that Black and Brown communities have debated, challenged, and struggled against police in schools for over 50 years. Ever since the institutional response to educational justice and community control of schools in the 1960s and 70s came not with more money, control, or sensitivity or increased equality. The institutional response came with more policing, punishment in schools, and also a trend toward educational divestment and social austerity. Real school safety comes from building strong relationships, strengthening social, emotional, and physical health and wellness, and addressing and preventing structural trauma. We have rigorous evidence that that programs that build these crucial elements create safe and supportive schools. Proven programs include school-wide positive behavior intervention and supports, often called school-wide PBIS, social emotional learning, restorative practices, and many others. We've submitted a more detailed summary of the research findings, but we'd like to highlight a few points here. School-wide PBIS focus on creating and maintaining school and classroom climates that positively reinforce good behavior school-wide, and then responding to children engaging in problem behaviors with a tiered structure of intervention and support. Rigorous evaluation of SWPBIS have demonstrated decrease in misbehavior, suspensions, increased and perceived safety and academic achievement. Again, I would remiss that not to mention an organization like Cadre, who was very instrumental in passing the first school-wide PBIS program in the country at LA Unified School District in 2007. Social emotional learning focuses on teaching self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. So the children learn to effectively manage their emotions, set and achieve goals, and understand and appreciate others' perspectives. A meta-analysis of 213 evaluations of SEL found that SEL programs, when implemented well, decrease behavioral problems and translate into an average of 11 percentile gains in academic performances. Next is restorative practices. Focuses on creating supportive schools that encourage all members of the school community to take responsibility for the action, repair harm that they've caused rather than use punishment or exclusionary discipline or police as a consequence for misbehavior. In studies at the Denver Public Schools, district-wide implementation of restorative justice cut both suspension rates and the black and white gap in half. And in randomized controlled trial of restorative practices in Pittsburgh Public Schools, implementation of restorative practices in elementary schools was associated with lower school suspension rates and smaller racial disparities, as well as high levels of school safety, stronger teacher-to-student relationships, and improved students' conduct. At the heart of these programs, what we really need to embrace is first a divestment reinvestment strategy. And of course, additional targeted resources of positive discipline and restorative practices are needed. Community control and participation is really critical. Reparative justice for targeted communities or schools, especially inside schools that have majority Black, Indigenous, Latinx, or working class communities. But we also need to look at squarely the challenges with these solutions is the context and intention behind their implementation. We've seen these programs hampered not to meet its full potential in several key ways. They cannot be implemented on a blank slate. Black and brown students and families have been harmed and had their trust in schools damaged through a long history of over-policing. It is essential that any implementation of these programs include a reckoning with this history and a meaningful process for repair. One important thing this commission can do is to document the educational, social, and emotional impacts of the school to prison pipeline and zero tolerance over the past 40 years. How many families were fined, sent to court? How many young people left school because of the punishment they faced in schools? How did the culture of punishment impact the public trust in public schooling? Part of that history has been involved the constant cutting of these programs at the same time as school policing has been protected. This has only reinforced the message that policing is more essential to the schooling of Black and brown students than their social emotional well-being or learning. For example, in LAUSD initially only invested about $600,000 in implementing school-wide PBIS. We went from 2 million to 10 million in implementing restorative justice. Those are pennies compared to the close to $70 million a year that LASPD was receiving. Finally, these programs are sensitive to racial bias and institutional racism. Research has begun to show how this effectiveness is diminished when they are implemented without fidelity and without careful attention to racial animus, implicit bias, or cultural responsiveness. Lastly, community control, participation, and leadership, as Jessica just mentioned, is fundamental to the success of these programs. The most dangerous approach would be to pretend these programs could be implemented on school campuses where school police remain, as if they could coexist, as if schools could create a positive school climate for Black students while stationing police at the front door, as if you can ascribe your school as sanctuary schools, but have 10-year-olds, 12-year-olds, or 17-year-olds being ticketed, handcuffed, arrested in school, or if prioritizing policing and incarceration at the municipal, state, and federal level doesn't also impact how our schools are run. I thank you once again, Superintendent, for giving us this opportunity. As you know, we've submitted over the past month several letters to you and the governor. DC California has provided important historical context, data, policy solutions, and long-term structural demands to not only remove police from schools, but also transform our schools, and look forward to continuing this conversation. Thank you.
Thank you so much for joining us today. And now we'll hear from Laura Talmas from Beyond Differences and Tom Peters from the Marin Community Foundation.
Thank you, Superintendent Thurmond, for inviting me here this morning. And good morning to our esteemed members of the State Legislature, Department of Education, the Governor's Office, and my fellow panelists. My name is Laura Talmas, and I am the co-founder and executive director of a San Francisco-based nonprofit, Beyond Differences. We are a social emotional learning organization. Our mission is to inspire students in middle schools nationwide to end social isolation and create cultures of belonging for all. We were the first in the country 10 years ago to address the hidden but diabolical effects of social isolation on children. At that time, few understood social isolation, but with sheltering in place, we all understand this now. Our strategy is to train students themselves to change their schools into fully inclusive communities in which all students are accepted, valued, included, and respected, no matter what their difference is. It is my long-held belief that a commitment to promoting deeply rooted social emotional learning programs such as ours is every bit as important as academic achievement. As fierce advocates of our children, we all know that allowing children to grow up with a strong sense of connection, belonging, acceptance, and self-confidence is among the best investments we can make for our future. I can speak personally about social isolation. Beyond Differences began after the passing of my daughter, Lily Rachel Smith, at the age of 15 and a half as a freshman in high school. Lily died in her sleep from medical complications associated with a craniofacial syndrome with which she was born. But during middle school, she would call me on a daily basis from the girls' bathroom where she was hiding, eating her lunch alone yet again, as the girls in her school did not want her to sit with them. Watching her suffer from losing self-esteem, declining academic achievement, and many other indicators, my husband, Ace Smith, and I made the difficult decision to pull her from our local public school and have her homeschooled for the 7th and 8th grades. After she passed away, former classmates came to her memorial service and heard my eulogy explaining why Lily had left the local community to attend an out-of-state high school. They asked what they could do to honor Lily's life, and that's how Beyond Differences was born. Beyond Differences now partners with schools in all 50 states, over 6,000 schools in all. More than anything, this dramatic growth shows the power and need of social and emotional learning. Here in California alone, our curriculum, student leadership programs, and national awareness days, such as No One Eats Alone, are being used in over 1,400 of our state's schools. We are especially proud that over 60% of our school partners are Title I. Students love Beyond Differences because we promote positive leadership at a critical age, middle school. And we know from evidence-based research that we are able to change the culture of middle school in just one academic year. And this year, thanks to our next speaker, my friend and philanthropic partner, Dr. Tom Peters, president of the Marin Community Foundation, Beyond Differences launched Advance SEL in California to engage educators, school leaders, and families in a wider conversation about how to advance, elevate, and spur action on social emotional learning in California. We used a bottom-up survey of teachers with the platform WikiWisdom to engage the opinions of over 600 educators. Among the highlights and recommendations are: 1, we must accept the fact that everything has changed, and so must we change too. We need to make SEL a cornerstone of all education in California. We need to avoid a mental health tsunami by coordinating resources and wraparound services in schools. We must demonstrate inclusiveness starting at the very top. And finally, we must bring families more firmly into the SEL world. What is our urgency? If you want to understand the negative impact of social isolation, think about this. Not every socially isolated youth grows up to become a shooter, but we know that every shooter has been universally described as socially isolated. Our North Star is to ensure that all children come to school each day and receive a foundational education embedded through the day with SEL, restorative justice, mental health, and well-being programs. We must also support and provide training for all of our teachers and counselors. Today, Beyond Differences relies 100% on philanthropic donations from individuals, corporations, and foundations to allow us to operate and keep our programs free of charge. It is my dream that there will soon come a day when there is a true partnership between the state and organizations like mine so that we can bring SEL to all schools in California. Let's start putting money into prevention, not police. We can do this today. Thank you.
Tom, would you like to speak?
I would indeed. Good morning. Let me join with Laura in thanking Superintendent Thurmond for the honor of the invitation to be here. Also in thanking the members of the state legislature here today for devoting their time to the important topics of today's hearing. My name is Dr. Tom Peters, President and CEO of the Marin Community Foundation. Prior to joining the foundation, I had a long career as a public health official. MCF, as we are known, serves as a philanthropic home to more than 500 families, each of whom is devoted to sharing private resources for the public good. Let me immediately focus on one of our proudest investments, support for Beyond Differences. I can say from my combined clinical and philanthropic perspective that I regard the work on social emotional learning as absolutely critical. MCF started as a first round investor in Beyond Differences more than a decade ago. Talk about a seed investment. In just a few short years, this small but mighty organization has reached over 6,000 schools in all 50 states. Fully 1/4 of the middle schools in America now use their curriculum and toolkits. In addition to the skillful determination that Laura and her staff brought to the effort, what accounts for this remarkable nationwide growth? It's because individual teachers across the country saw an urgent need for focus on social emotional learning in their classrooms, and because thousands of students enthusiastically and proudly joined the effort to end social isolation and to create fully inclusive school communities. This rapid growth also reaffirmed for us as philanthropic investors the powerful fact that social emotional learning is something whose time has definitely come. We've also come to learn that there are a number of trusted partners in the nonprofit world who are delivering these programs with fidelity and trust. That's why I am so proud of one of our most recent grants to Beyond Differences, the special funding for Advance SEL, the collaborative campaign to which Laura just referred. And we're particularly appreciative to work with State Superintendent Tony Thurmond and his office, the Office of First Partner Jennifer Siebel-Newsome, and the Governor's Office. Advance SEL is already having a tremendous impact, serving as a catalyst for critically needed conversations and coordination on social emotional learning resources. Resources for our state's 6 million children, many of whom have been grievously harmed by the rise of social injustice and equity disparities to which they've been exposed all their lives. One final thought, I would submit that this work also serves as a stunning example of the power of partnership. The partnership between government and philanthropy, the partnership with schools, teachers, education experts, and strikingly, partnership with the students themselves. It is clear if we exhibit the will, we certainly have the power to better the lives and the learning for all of California's students. This can be a profound moment of change to move money from police in schools to peace in schools. Thank you very much.
Thank you so much, Tom. And we have about 5 minutes for Q&A. So if anyone would like to raise their hands or in the participants, if you see in your screen, there's a participants, you can raise your hand or put in chat if you'd like to ask a question of any of our panelists.
To our legislators, do any of you have a question at this time? Just checking from right to left and left to right on my screen to make sure that we don't miss anyone. If at any point you have a question, just send us a note in the chat. We'll be happy to take your question. Thank you, Mary, for that. I also want to thank Jessica and Manuel for what you shared, your data, your experience, grassroots organizing, your keep it real messaging to help move the conversation forward. Thank you for what you've done. Thank you, Dr. Peters, for supporting Beyond Differences and supporting Advance SEL and for your leadership. Thank you, Laura Talmas and A. Smith, for creating Beyond Differences and from sharing your personal story and using it to help others. We are grateful for the connections that you've made to address and expand social emotional learning in our state and in our nation. Thank you. Stay tuned. We may have questions for all of you. We do want to move to panel 2, where we ask some of our partners to help us figure out how do we now act on these programs. We've all known for a long time that these are the right programs for supporting you. You all in our first panel have given the emphasis. These are evidence-based programs. These are programs that are proven to work. We've got to be able to fund these programs in ways that allow us to make the most impact. I'm excited about the panel that we have before us. First hearing from Alex Briscoe from the California Children's Trust. Alex, I'm going to ask you to give us the blueprint on how to maximize the amount of federal dollars that exist And how do we get past the barriers that have gotten in the way of using these dollars? You've often pointed out how California leaves money on the table because of some of the barriers and how these programs are built. I know that you've got a blueprint. For those of you who don't know Alex Briscoe, he has probably created more school-based health centers than anyone, certainly in Alameda County, where he served as the Director of Health Services. He has continued to be a champion for expanding mental health and health programs for young people. He's an innovative leader, a friend and a colleague who I'm grateful to have share his perspectives today. Take it away, Mr. Briscoe.
Thank you all. I hope you can see my screen. And I'm going to ask everyone to take a deep breath because I'm about to take you down a rabbit hole of Medicaid. And I hope you all in 7 or 8 minutes walk away with a couple essential elements about a very complex program. So I once had a mentor say to me, we have the most complicated descriptions for the things we understand the least. So I'm going to try to distill a complex landscape for all of us, because at the heart of achieving justice for young people in California is a full and complete understanding of California's Medicaid program. So I'm going to do this actually in 8 minutes. I'm going to talk about a paradigm shift at the nexus of health and education. I'm going to skip the context because Laura beautifully spoke to it. If you don't know, in the decade before COVID, twice as many children went to emergency departments for self-injury and suicide attempt. And while length of stay in hospitals decreased across all disease burdens, it actually increased by 50% for pediatric mental health. We have had a legitimate youth mental health crisis in our culture and society for more than 2 decades, and we have not responded to it. In fact, we've put gasoline on the fire with the social isolation of COVID-19. Schools are essential actors to any solution at scale. It is not just that schools need, but schools are actually an important and critical resource to the healthcare system and to any broader social justice and racial equity frame. I'm going to break down how Medicaid works. I'm going to show you how federal dollars flow to the lives of children and families through 7 different intermediaries, but I'm going to tell you the 4 that are essential for schools to know and understand. I'm going to explain the 5 emerging models, and then I'm going to tell you where all of this stuff is getting talked about so you can plug in where you want. So first, schools are ground zero for the youth mental health crisis. I don't need to tell anyone who's listening to this, that's true. But healthcare system needs schools. Children 8 to 18 have the lowest rate of primary care utilization of any demographic in the Medicaid program, meaning they go to the doctor the least. So any solution that relies on children going to a primary care physician is dead on arrival. We must think of schools as the new front line of clinical and social and emotional development for children. And I'll name a really important point that I think Jessica highlighted. I have personally billed hundreds of millions of dollars to Medicaid mental health services. 90% plus of the young people I served were not pathological, though I had to give them a diagnosis to get paid. So let us walk carefully into this new opportunity that I'm going to describe. We should be very wary of pathologizing children to justify the revenue I'm about to describe. I do not believe that a diagnosis is necessary or even consistent with federal guidance. The same benefit that covers mental health covers immunizations. You do not have to have measles to get a vaccination. Finally, the finances align. In these dark times of dropping budgets and scarcity, schools have what the public Medicaid system needs, which is access to the kids, and this key point that I'm going to spend the rest of the time describing, which is the type of dollars that are eligible for a match. We call these certified public expenditure. So if I spontaneously combust, I hope you take away from this presentation that there are financing opportunities for just and equitable service expansion in schools. But to act on them, we must reform 2 public systems, not just education, but also Medicaid, so it can be transformed to be just, equitable, and healing centered, acknowledging the impact of structural inequality, structural racism, and the stabilization of poverty on the health and welfare of children. Quickly, there are 6 million of California's 10 million kids are now covered by Medicaid. That's been a 33% increase in the last decade, 5 years. And it is actually growing, as you all know. We anticipate that there'll be a 20% growth. Less than 5% of these 6 million children are getting a service, and less than 3% are in ongoing care. We could legitimately reopen schools with 7 or even 8 out of 10 of all children being covered by a federal entitlement. We aren't doing so great in Medicaid, and this is, of course, no personal attack on anybody, but we rank in the bottom third nationally on spending. Children represent 42% of all enrollees and 14% of all expenditures. And an April 2019 audit pointed out the state's, frankly, abysmal performance in overseeing managed care plans, who are the sleeping giants of this work. So let's dig into the basic structure of Medicaid. And while I'm going to give you some details in a second, they all distill to the same principle. Think of Medicaid like a pot of gold sitting in DC. You get $1 if you put up $1. Every Medicaid expenditure is part state and part federal. But the state money often comes from the counties. So one of the key things I would ask all stakeholders to think creatively about is, where does that state dollar come from? It doesn't just have to be state general fund. It can be all kinds of other local resources that are eligible for a federal match. So these two together equal a Medicaid expenditure. One is called a certified public expenditure. One is called federal financial participation. And so I fully recognize, everybody, that I'm going fast, but I've got a time constraint and I'm trying to distill. So stick with me. These are the definitions of CPE and FF&P. But remember, 7, almost 8 out of 10 of all kids in public education are eligible for this benefit. It's uncapped at the federal level. The feds can't say no if we put up the money. We just got to learn how to put up the money. So let me track that federal dollar down into the lives of a child or student. So this on the left is representing that federal dollar, that pot of gold I referenced. It gets matched by either state or local funds. Let's talk about how it arrives in the life of a kid or family. The first is the managed care plan. This is the biggest source of funding. The second are the mental health plans. The third are the school districts. The fourth are the community health centers. The fifth are the public health departments. The sixth are the public hospitals, and the seventh are the regional center. The key ones for schools to understand are the first 4. And the way schools are accessing these funds are in 5 different models. School districts are acting as an intermediary and securing revenue through one of those or 2 of those 4 payers. Special education, SELPAs are doing it. The dominant modality is a private community-based organization, contracts with the local mental health plan and does it. Sometimes the county health authority will play an intermediary role and manage services across multiple school districts or sites. And increasingly, county offices of education are stepping into this space. I'm going to skip through a description of each of these 5 models because of the constraints of time, but you can find this deck on our website, and also CDE will publish it. So in the next 5 slides, I'm going to flip through them, but they quickly state the details of each one of these. This is the LEA model, this is the SELPA model, this is the CBO model, and this is the county health authority model. So to wrap, there is a lot of places where we're trying to mine this opportunity of the fact that we spend a lot of money in California, but don't do a good job of matching it at the federal level and partnering with schools to access the essential service in the health and welfare of children. When you look at what kids, they're all behavioral in nature: homicide, suicide, and injury. Those are the 3 leading causes of death. Doctors don't treat those things. Peers, case managers, and therapists do. So in order for those on the call to track kind of the key tables where this stuff is going down, I'd like to highlight that there has been a recent state plan amendment that expands the ability of schools to bill Medi-Cal for children beyond special education. This was one of those streams I referenced. Another critical one is the Department of Healthcare Services on June 19th gave new guidance that actually significantly opens up the opportunity to bill managed care plans without a diagnosis for the first 5 visits. This is a huge win, and I congratulate DHCS for this essential reform of the medical necessity criteria. These are 2 short-term opportunities that can lead to specific revenue. but also SB 75, Medi-Cal for Students, the upcoming Behavioral Health Task Force that has met once. These are also system level statewide design opportunities that funders and advocates should track. Finally, I did want to reference the after school funding that is managed, called ACES, is a huge opportunity for us to leverage additional federal revenue. For more information, see the California Children's Trust, and thank you so much for listening. I know this was a lot. Thanks, Tony.
Thank you, Alex. You actually found a way to get across so many key points on how we can draw down more Medi-Cal dollars. And please stay with us because I know there will be questions. And thank you for your work in this area. I want to go to Director Will Lightbourne, who heads the California Department of Healthcare Services. That agency is most connected to some of the programs that Alex talked about. Due to scheduling needs, we're going to shift just a bit in our order. Director Lightbourne is no stranger to any of us. He's been a champion for young people. We are grateful to him for his work. You know, my opportunity to first work with him was around our work in the Assembly around Health and Human Services. So much great work to support young people in foster care and others who are homeless, who have other needs. We're grateful that he is now skippering the effort at the Department of Healthcare Services. If you would, Director Lightbourne, we'd like to hear your thoughts about where you see the opportunities for us to work together to do more.
Of course, and thank you, Superintendent Thurmond. And good morning, everyone whom I can't see, but I know are there. As Superintendent Thurmond said, I'm Director of DHCS. Just very quickly, and picking up from where Alex was briefing you a moment ago, the LEA briefing option is, of course, available for health-related services provided by qualified health service practitioners to Medi-Cal eligible students, so long as they're under age 22. It currently generates about $130 million a year in federal funds that are going to about 600 LEAs. As Alex mentioned, the new state plan amendment that was approved in April added new service practitioners and new services to the billing option program. It expanded the population covered to include Medicaid beneficiaries outside of special education and the limits on the services that could be provided. We have another SPA pending, which would allow LEAs to be reimbursed for targeted case management for students not in special education. And a further one to expand comprehensive vision services. As Alex mentioned, and as folk are aware, the SB 75 work group has been meeting since August of 2019. Events of the pandemic have undoubtedly sort of made some of the meetings be rescheduled, but we think we're on track to have the report to the legislature by October 1st, 2021, to ensure that we're sort of using all opportunities to both obtain federal resources and deliver the services needed at the schools level. On a sort of an ongoing basis and outside of the SB 75 process, the local government financing division staff provide technical assistance to the LEAs, do training, do in-person meetings to try to encourage participation. In the last few weeks, we've sort of been meeting, of course, with the superintendent and his key folk to talk about how we can get outreach materials to LEAs who are not currently participating in the billing option program to make them familiar with the fact that under the new SPA, there are expanded opportunities. In dialogue, both with CDE and with other stakeholders, clearly there are perceived to be obstacles to participation, concern that it can be administratively burdensome, concern that audits can place LEAs at risk. we'll certainly be looking on our end to be sure that there is, that we can simplify processes to the greatest extent possible, and that we can operate our billing system, our auditing systems in a way that is, while taking the steps necessary where federal funds are involved, is sort of maximally user sensitive, so that we're not in any way sort of disadvantaging LEAs or discouraging them from participation where opportunities do exist. Another area to probably quickly mention is that something which I think, as we work together to expand utilization, we certainly want to be sure that we bring in the community behavioral health agencies as full partners in this, because to the extent that we can have the LEAs working through the CBHA network, that can also ensure that students are getting year-round access to necessary services, treatment, et cetera, that might otherwise only be available during school year periods. I would just sort of conclude by saying we really welcome the opportunity. I welcome the opportunity, and speaking for DHCS, we do, to work with the superintendent and his team. Obviously, as we start to re-engage students in the school settings, they're going to come back to school with increasing needs, and our ability to respond to those needs is something that I think we all share a commitment to doing. So thank you for letting me participate this morning, Superintendent.
Thank you, Director Lightbourne, and really thank you for letting us know that schools can participate in the LEA billing option at a higher rate, that given to the changes that you described in the plan amendment, that there is opportunity for more utilization. And so this is helpful, and we want to spread that word and help our schools to take advantage of those programs for positions like counseling and other positions that qualify.
Absolutely.
Thank you. We're going to continue in this similar spirit. We're going to talk a little bit about the Title IV-E funding that many of you know who work with youth who are in foster care or in probation systems. Can it be used to support those youth, but can it also be used in a broader way to allow us to serve more youth with programs like restorative justice, for example, or de-escalation programs? We're going to hear from Ken Barrick, who is the Executive Director of Seneca, the CEO of Seneca. He'll give us some perspective. They provide training to many organizations using Title IV-E dollars. And then we'll hear from Kim Johnson, the Director of the California Department of Social Services, the agency that works most directly with these funds, to get her thoughts and perspectives. Ken Barrick is no stranger to our work. In addition to being an elected school board member in Alameda County and focus on equity in those areas, he is the CEO of Seneca, an agency that works statewide to support young people in foster care, young people with special education needs, young people who are homeless, young people who have mental health needs. He's an expert, a great advocate and friend. We're glad to have you here to provide some emphasis. Mr. Barrett, please take it away.
Thanks, Superintendent. So I just want to begin by saying that we're in a remarkable moment, and it is not by accident that we're here, and that it would be Superintendent Thurmond that brought us here. All the way back to his days at Beyond Emancipation, Superintendent has understood how the systems need to work together to make things work. And when we talk about this remarkable moment, we have a healthcare services director that's been the social services director. We have a governor and a legislature that understands and are interested in these issues at a level that we haven't seen before. And we have a crisis in our community that brings us to a point of finally understanding that there's a moment right now to do something. But it doesn't really matter how much we recognize that moment if we don't have mechanisms. And so Alex took us into the weeds, and I'm so thankful that he did. Because if we can't figure out the mechanism to maximize federal funding to be able to do this, I guarantee you we cannot do this with school funding alone. It can't be done. And we've seen this time and time again, that programs start up but that the funding isn't adequate. So Alex talked to you about how to maximize mental health funding, how to bring federal funding in to match funding at the local level to maximize the mental health side. I want to talk to you about the 4E side, the child welfare side. And I couldn't be better set to do that because Jessica talked about trauma and how you can do culture and climate efforts. Manuel talked about the incredible efforts of Maisie Chin and her partners at Cadre to bring PBIS, positive behavioral intervention and supports, into schools at scale. And Laura talked about social emotional learning and trying to scale that. When you look at those and then you look at the strategies that can be used to do that, you can use mental health and Title IX funding, as Alex talked about, but you can also use social service funding in the form of Title IV-E. And there are three mechanisms to do that. First, I want to talk to you about 4E training, which can be a 50% and even higher match and can be used to create trauma-informed schools. And one of the best examples of that is restorative justice. And restorative justice recognizes that rather than saying, what did you do, what happened to you, is a formative way to think about what's going on with youth in our schools and create just schools that can support them. So where you have kids that have been affected by trauma, who have had opportunities to come into contact with, in the past, law enforcement, those can be opportunities to come into contact with the restorative justice intervention that can be funded by Title IV-E. And it can be funded by framing this as a response to trauma, to abuse and neglect, and training all teachers about what trauma means for schools and what a restorative justice approach can do to resolve that. And so one of the mechanisms where we have numbers of youth who have been in child welfare is to use Title IV-E training as a mechanism. In addition to 4E training, there's already a format that Department of Social Services has created for schools to create memorandums of understanding with their social service department for 4E admin costs. And those costs can be maximized for services like foster youth services that can also help to implement some of these interventions. And finally, and equally importantly, right now, we have thousands of youth that have access to wraparound services, which is the most comprehensive service set that we can provide. Except that those wraparound services are typically restricted to youth who have come into child welfare. So that means in the instance of schools, a teacher has to make a report to Child Protective Services. And in most cases, a child actually has to be removed from their home in order to receive wraparound services. That's just wrong-headed. When you ask teachers why they made a CPS report, in many cases, they will say, because we didn't know what else to do. If we could work to create a format where those wraparound services, those restorative justice trainings, and those foster youth services could be available in a more preventative way, we could maximize those federal dollars, and we could have whole schools that were trauma-informed and implement the kinds of strategies that the speakers before me have talked about. So we have a moment. We have a moment where educators could access services in a different way, where they could partner with healthcare services and child welfare in a preventative way rather than a reactive way. And we could rely on positively based just interventions rather than on interventions that are onerous and punitive. Thank you. Oh, I'm sorry. And now I want to introduce Megan McQuaid, who's going to actually take you to some of the technical ways in which that can be done. Sorry, Megan.
No problem.
I got carried away.
No problem. Thank you so much, Ken. And thank you all for inviting me to speak with you this morning about Title IV funding and the opportunity to build teacher and school capacity to make schools safe and welcoming space for foster and probation involved youth. So Title IV is a funding source used across the country to support foster, adoptive, and probation-involved youth and their families. With the scarcity of funding available right now to implement training, as we discussed today, leveraging this federal funding source should be explored. The training portion of Title IV funding is used in California currently to train resource families, provide orientation to new child welfare workers and child welfare supervisors, to train private agency staff like at Seneca Family of Agencies, as well as caregivers and professionals that work with the foster and probation involved youth. So I'm asked to provide some guidance as how California is positioned to meet the requirements of Title IV as a funding source to support teachers and school personnel. So the first requirement is that funding passes through an educational institution. There are many colleges, universities, community colleges throughout California that already partner with both the State Department of Social Services and local social service agencies to access these federal dollars. The next requirement is if school teachers and staff are eligible participants. And in 2009, California Department of Social Services provided an all-county letter that provided guidance that educational providers and advocates are able to attend trainings funded through Title IV as long as it supports the well-being of foster youth or probation-involved youth. So this all-county letter really sets the precedence that we can fund restorative justice training. We can fund other trauma-informed practice that Ken and others have mentioned today through this funding source. So similar to how Medi-Cal and Alex was talking about Medi-Cal, Title IV also requires a non-federal matching funds. And similarly, there's also many ways you can meet that matching requirement. So one model is to create an interdepartmental and college agreement that the salaries and fringe benefits of public staff are actually allocated to the college and Department of Social Services as that matching fund for the time that they are in training. So this doesn't mean that teachers are not going to get their salaries. It just means that the public agency is certifying that the salaries and fringe benefits were not paid by federal funds and therefore can be claimed. So this isn't a new model. A colleague of mine worked in Louisiana to develop the Pelican Center for Children and Families. And it's a collaborative of Louisiana Department of Children and Family Services and Louisiana Court Improvement Program and Southeastern University. And they provide interdisciplinary training for attorneys and judges and CASA workers, foster parents. So when a judge attends a training that's funded through Title IV, their non-federal salary and fringe benefits are captured as expenses. And then that's expense is part of the federal claim. So in addition, educational institutions' indirect expenses can be also allocated. So if we leverage all these different existing local funding sources, this can be potentially a very small portion that California needs to put into local funds, or even at no cost to California to make this happen. So lastly, the funding must be directed to improve the well-being of foster and probation involved children and youth. So there might be some districts in California that may not qualify because they don't have enough foster and probation involved youth, but a significant portion will, and it'll get us started. The fact that the teachers and the school staff are being better prepared to utilize alternative interventions and reduce the presence of police on the campuses will greatly benefit the foster and probation youth, but it also benefits the larger population, the families and the communities. So our families are needing us to do something different right now. And I think that providing Title IV funded training in schools is an easy and fairly quick response.